Hi and welcome. It's Jessica Drummond here from the Integrative Women's Health Institute. And I am here to hanging out with you with Hilary, our health coach. And welcome, Hilary. How are you?
Good. How are you?
Good. So today we have some really exciting information for you. We're going to really walk through the steps for our approach, this holistic, integrative approach to managing and really getting rid of from the root cause pelvic pain issues. So we're going to dive into a presentation here. Let me share my screen with you and we'll get started. So I need to do one thing. Nope, that's not going to work. Hold on. Minor technical issue. Okay, here we go. All right, so welcome. We're going to talk about 4 of the most common challenges that women see when they're trying to relieve pelvic pain and you feel like you've tried everything. So we're going to walk through how we solve these more complex concerns and challenges. So welcome. So if you're saying to yourself today, okay, I've seen so many doctors, so many healthcare professionals about my pelvic pain. Why is this so hard? And the answer is really that pelvic pain is complex. If we think about the pelvis as being a bowl, that it houses quite a few of our different physiologic systems. And we're going to walk through that. Almost all of the body's systems can be involved in any given situation of pelvic pain. And your pain is never in your head. You're not crazy. This is a real experience of pain. And for some women, it's very intense. So anytime a healthcare professional dismisses you and says, oh, just relax, have a glass of wine and chill, you'll be fine. Have you heard that before, Hilary? Have any of your patients heard that?
Yeah.
Yeah, that is just ridiculous, and run as fast as you can away from that healthcare professional. But while the pain is not in your head, it's real experience of pain. The decision about pain and where it is and the intensity of it, much of that decision is made in the brain. So we have to focus not just on the pelvis, but also on the optimal health of your brain. And we'll talk about that. It takes an interdisciplinary team because we're working with all of these different physiologic systems. And I want to help you shift from feeling like you're on a quest. You're going from doctor to doctor, clinician to clinician, trying to find someone and something that can fix this problem, to stepping into the role of leader, manager of your own health, and recognize that in most cases of pelvic pain, especially more complex cases of pelvic pain, you're going to be the leader of your healing team and making decisions day to day that will help improve your health. So it's not a quest to find the one golden nugget, the one person who can heal you. You have all the internal healing wisdom that you need. You just need to learn over time how to activate that and how to support your systems to heal. So let's talk about how to do that, because that might sound a little overwhelming. So first of all, I'm not sure where you're seeing us. I'm going to move this little thing so you can see us better, or you can see the slide better. So let's get to the root cause of your pain. That's my goal with this presentation, is to start to think about pelvic pain not as a symptom that we have to shut down with some magic bullet medication or surgery or supplement or therapy technique, but as a warning, as a message, as a signal of a deeper root cause that needs to be optimized. And in many cases, many root causes. A lot of times, a number of things are going on at the same time. And at the end of this webinar, I do have a special invitation for you, so stay tuned till the end. You can also watch the replay. if you can't do that right now. And please eliminate distractions. I am just like you. I have kids, I have a job, I have a husband, I have cell phones, I've got a messy office all around here. But if you can, for the next little while, just shut everything else down and try to be present with us. So to introduce myself, if you don't know me, I'm Jessica Drummond. I started my career as a physical therapist. I initially specialized in orthopedics and sports medicine, and I was a gymnast as a kid, and I just always thought I would go into sports medicine. But pretty quickly, I began to specialize in women's health about 2 years after I graduated from physical therapy school. And that was back in 1999 now. And unfortunately, several years into my career, about the time I had my first daughter, which was, she was born in 2003, I had a really intense experience of burnout, pain, constant illness, infertility. And so I've lived this. I understand what it feels like to have a complex illness that no one understands. And I didn't understand, despite having almost a decade of experience at that point, or several years of experience in working in, really wonderful, different hospitals. I still did not get great care. I did have a pre-childbirth diagnosis of endometriosis. However, it wasn't a true diagnosis in the sense that I didn't have a laparoscopic confirmation. So who knows if I had endometriosis or not, but it did flare up. My pelvic pain flared up after my second baby was born, and I was admitted to the hospital twice. Eventually, I healed naturally with the support of some colleagues and natural estrogen detoxification strategies. I also had adrenal fatigue, which essentially is just a fancy word for a hormonal crash after my first daughter was born. And, really, I ended up just digging into this self-healing, going back to school. I got my doctorate in nutrition last year, and I've been practicing nutrition for almost 10 years now in collaboration with physical therapy, because I really feel like physical therapy is an essential part of healing pelvic pain for many, many women, but it's not the end of the story, and surgery is not the end of the story. It really does take a holistic, integrative approach. So that's where I bring all my clinical experience together with my personal experience and around my birth stories. And here's my little one when she was just 2. So in many ways, I understand where you are, and I have deep empathy for how frustrating that is when you are sick and you have no idea what's going on or what your next step is. So I hope we can shed some light and hope on that, because we've walked that. Now I'd like to introduce you to Hilary. She is our health coach around here at the Integrative Women's Health Institute. So Hilary, tell us a bit of your personal and professional story.
Yeah, so my training is actually in occupational therapy. So I am an occupational therapist. A majority of my career has been actually in pediatrics, more specifically the last few years in early intervention. And one of the things I learned as I was going into women's homes with young children and talking to them and everything like that is just how common it is for women to struggle with fertility, with endometriosis, with just painful periods, with these pains that they've had for years. And we would get to talking and they'd be like, we've been to doctor after doctor after doctor, and we haven't had any help. So from those experiences, I found Jessica, and I've taken her courses and just learning from her. And it's just been a journey to help other women and also to help myself. So along with that, I have a lot of friends who have also struggled with infertility, who have struggled with pelvic floor issues, who have had multiple kids and they're leaking and they're told that it's normal, or it's normal that their periods are short, that their periods are long. It's okay that they get their period every 20 days, all of those things. And it's not normal, but nobody's there to kind of help them through it. And then also just meeting women who did go to their doctor and their doctor just didn't listen. And he would just be like, well, it is in your head, or we can give you medications for it, or we can do all of these things to alleviate the symptoms, but they never actually got to the root cause of what was going on. So that's kind of my professional journey. And then personally, I have 4 babies. My oldest is 7. My youngest he's about 2 months old now. So in between baby 3 and 4, I felt like I was depleted. I mean, I've had 4 babies over 7 years. I never took the steps to nutritionally kind of build myself back up, and take those steps also just from a mental health perspective and just meditation and all that kind of stuff. So after my 4th baby was born, it took me a while to, I know you say feel like yourself again, but I was just tired all the time, which you have a new baby and I get, but it just felt more than that. About a few weeks after that, I broke out in a systemic rash everywhere. And I was just like, what is going on? So of course, nobody wants to be in a rash. Nobody wants to be itching all the time. So I went to a dermatologist. I dragged all 4 of my kids to the dermatologist, which if you have ever tried to drag 4 of your children to the doctor. I can barely take
one of my kids at a time anywhere, and one of them's 14.
I know. So. It is horrible. And then everybody looks at you like you're crazy because you have 4 kids in general, and then you're dragging them to the doctor. So we waited 30 minutes in the room for the doctor to come in. And she spent 5 minutes with me and told me it was eczema. And she gave me a steroid cream. And I was just like, no, this isn't going to work for me.
Yeah.
So I elicited the web of support, which we'll talk about later. And I just tapped into different people in my community. And I was like, who can I go to that is really going to support me? So we have an awesome naturopath where I lived. I went and saw her. It was a 2-hour and 15-minute appointment. She worked with me. And from that, I just learned so much, just kind of what was going on in my body, just my parasympathetic nervous system was non-existent. My ANS was kind of in overdrive. I was pretty much in fight or flight mode all the time. And because of that, just my intestines were inflamed. My whole body was inflamed. And this was just the reaction for it. So it was empowering to finally have answers and to feel like I can actually finally do something to help myself and to heal myself and go through that journey. So learning how to move, eliciting self-care, changing my nutrition, adding supplements, all of that stuff. And it has made a big difference. And it even hasn't been that long. And that's just something I want to empower all of you guys with, that it is possible to see changes in your life.
And I think it's more possible to see changes more quickly than sometimes we might think. You know, it seems like sometimes if the issues are complex and they're very long-standing, yes, it may take longer, but there is a trend there. You can see some sparks of improvement pretty quickly as we start to bring this kind of entire focus on holistic care and not just like, let's drill down into this one symptom or let's, try to patch this one thing. So let's dive into the content and talk about some of the challenges that women who have pelvic pain have to go through when they're trying to get help. So as I mentioned before, there's this quest, and it's kind of like what you just were talking about, Hilary. You put all your kids in the car, you go doctor to doctor, you go see this person, you see that person, and you have the mindset that they're going to fix it, right? You walk in and you think they're going to wave the magic wand, they're going to put the cream on, they're going to, do something, give you a medication that's just going to fix this problem. But unfortunately, most of the time with chronic pelvic pain, there's not a one-size-fits-all protocol. And it's just like then what you had to shift to. You sit down with a naturopath, or in our case, a nutritionist, health coach, the group of your peers who are supporting you, and you walk through a systematic approach that looks at all your physiologic systems, your gut, your immune system, your nervous system, your autonomic nervous system. And you look at, okay, which of these systems is overwhelmed? And a lot of times for women who have pelvic pain, who've been struggling for a long time, or women who are postpartum or in perimenopause, sometimes there are more things going on than just, a diagnosis of vulvodynia. You might have bladder pain and hormonal issues, or painful sex and chronic headaches. It's often that it's not just one thing in isolation. And so we walk through the various systems, which takes a little longer, but you begin to have some understanding about what's going on in your whole body. And as you can see here, and you know, when you have pelvic pain, often it's not just one clear thing. It's not just endometriosis. It might be endometriosis and bladder pain and vulvodynia. You know, you may have cyclical pain and PCOS and PMS. You may have, you might have been told, as Hilary was saying, that your painful periods are normal. It's okay. In fact, even the section on women's health of the American Physical Therapy Association released something the other day that said, mild period pain normal. I was like, no, it is not normal.
Yeah, no.
Not normal. So pain is not normal. Now, if you're a little bit more fatigued, you're, feeling there is an ebb and flow to our monthly hormonal cycle. But if you are ever to the point where you can't go to work, or you can't stand to make dinner, where you're just exhausted and in pain at any time, even if it's just for a day every month, that is not normal. So a lot of these things you might have been told, these short cycles are normal, painful periods are normal. I mean, I've seen all those commercials, right, with the girl. I can't remember what that's for, but it's for some kind of like period thing where the girl's the camp gyno. Have you seen that, Hilary?
I have not.
It's like a crazy commercial for period packs or something for teenagers. So here they're telling like teenagers, you're going to need ibuprofen every month, and here's your tampon, just like expect to be writhing in pain. That is not normal.
I know so many women that they're like, oh, my period, let me grab the Motrin.
Yeah.
And I'm just like, oh, you don't need to.
Well, and it's also risky because ibuprofen, non-steroidal anti-inflammatory drugs, cause digestive issues. They increase women's risk for heart attack, and they can contribute to certain kinds of ovulatory infertility. So if we've been teaching girls to take these every month since they're 12, we're having some long-term systemic health effects. So that's not normal. And finally, and this is talked about a little bit less in pelvic pain, but gastrointestinal issues like IBS or constipation or inflammatory bowel diseases often also overlap with pelvic pain diagnoses, in addition to things like pelvic floor dysfunction, pelvic floor muscle and nerve issues.
Yeah, that's one I see a lot is like women that need to take like Miralax.
Yeah.
And even in the pediatric population, you see it all the time. And just doctors like, okay, just take Miralax.
And that's another, right. And this is another drug that has serious long-term health risks. It's not something to be using as a solution. So many systems converge in the pelvis. The gastrointestinal system is where we begin, because if you can't take in nutrients, if your gut and your colon and your rectum are inflamed, because the organs of the pelvis are sitting so close together, there's this issue called organ crosstalk where if your irritated colon will literally kind of through close by neighborhood associations, talk to your uterus and bug it, irritated. Imagine if you've got some annoying neighbor next door, right? It's the same idea. So you may not actually have a uterine problem or a bladder problem, but if your digestive system in the pelvis is irritated, it can, through organ crosstalk, irritate the other organs in the neighborhood, and vice versa for the reproductive system to the digestive system to the bladder to the nervous system to the muscles and fascia in the region. So this could even be an issue if you have a history of a hip injury or a pelvic fracture or something like that, right?
Tailbone injury.
Yeah, tailbone injuries, which are also common in childbirth, pubic symphysis issues, so a childbirth, another common structural issue of childbirth, and the immune system, because don't forget, 80% of your immune system is wrapped up in your digestive system, which is all living in your pelvis. And so this is just to demonstrate, look at all of these organ systems, look at how close they are. The fascia is right next to each other. If you look at the pelvic cavity, this is an image. If you kind of take off someone's front, here's their spinal cord, here's the pelvic bowl of tissue, of muscles, of bones, of fascia, and then sitting right in this little tight space are your bladder, are your uterus, is your rectum and colon. And so there's a lot of nervous system, fascial, musculoskeletal connections here. So in this tight bowl, if something is irritated, the surrounding neighbors can also be irritated. We have to address the whole system. So other issues that we have to systematically approach in each individual woman is, what are your hormone variations? Are they normal? Are you struggling with perimenopause, or do you have shortened cycles because perhaps your progesterone levels are low? Is your stress hormone really high because maybe you had 4 babies in 8 years, right? 7 years. Or like me, my stress hormone just kinked out after 1 baby. So, you don't have to have 4 babies in 1 year, in 7 years. Systemic inflammation. Some women are actually more genetically vulnerable to having pelvic or vulvovaginal system symptoms if you have inflammation or an autoimmune picture. Genetic risks also trigger, in some women, more changes in the brain's neurotransmitter sensitivity to pain. So you might have difficulty with breaking down hormones in your liver. You might have difficulty with your body building up certain feel-good brain neurotransmitters, which help quiet those messages of pain. You might be at more genetic risk for having chronic urinary tract infections, which can certainly irritate that neighborhood. Similarly, if you have trouble with your gut bacteria, you can have chronic yeast infections or chronic bacterial vaginosis. And again, pain is a decision made by the brain and central nervous system. So if your brain is inflamed, or you're anemic, or you're just eating a lot of sugar, or your blood sugar is out of balance, or you're not getting enough oxygen to your brain, maybe you're like sitting like this all day at a computer, right? You're never resting, breathing. You're never, as Hilary said, her whole body broke out in a rash because there was never a time in her day, in her week, in the last 7 years where she could just
sleep.
Sleep, breathe, right?
Yeah.
Yeah. And that's really important. We so underemphasize how important it is to have recovery. We're super busy as women, but we need to balance with recovery. So let's talk through challenge number 2. Number 1, no, it is not in your head, but it is in your brain. Pain is a decision that's made by the brain. So it's not necessarily an accurate signal of the seriousness, extent, or location of physical local tissue damage. So you can have really severe vulvar pain, and yet your vulvar tissue can look and be normal. Mm-hmm. It's a danger signal that's released from the brain, and it's influenced by a whole number of other factors related to the fact that all of these systems can be involved. So some factors that promote a more intense pain signal from the brain are a history of trauma or sexual abuse, especially in particular transition times in childhood, in the teenage years, or during the perinatal period. Maybe you had a birth trauma. Mm-hmm. Lack of feeling of safety in your body or in your life, financial stress, lack of healthcare access, domestic abuse, lack of supportive community of friends, sexual harassment at work, and so forth. So think about that. If you don't have a support network, your brain is going to be more on high alert because, evolutionarily, women were living in, kind of tribal communities, and it was much safer if there was an ecosystem of other women protecting each other and other families. If you don't have that, and whatever that looks like in modern life, which is going to be different from family to family and person to person, but if you have that sense of support with your healthcare team, support with your home and family and friend team, it's going to be a whole lot different for your nervous system to just relax rather than constantly having to be vigilant about your safety. And that changes what parts of your brain are sort of constantly on and vigilant. One kind of interesting thing, there's actually this sort of vigilance center in the brain, and it's very rarely off in women. And men, it's actually off more often, which is kind of interesting. There's only 2 times that it's been seen on functional MRIs to kind of turn off the vigilance center in women. And that's during mindfulness meditation and during orgasm. But if you have pelvic pain, you may struggle to have regular orgasms. So, and we need that because we've got to quiet our sympathetic nervous system.
Yeah, and I see a lot in kind of that post pregnancy population of just dealing with the trauma of their birth and just that guilt of they did something wrong or like it was their fault, and just kind of processing that. And a lot of women don't process it, and they just hold that tension in their muscles, and they don't know how to release it, and they don't know how to kind of deal with that, whether it be guilt or whether it just feel like they're not enough, or that somehow it was their fault. So I think that's really important part of this. And that can then down the road affect kind of your pelvic pain and sex and just all those kind of things. So.
Yeah. And, I really understand that completely. My second daughter was born probably 10 days too early. And I had induction by acupuncture. And then eventually by Pitocin. And I had been on bed rest for 3 months, and she was just, not quite ready. I thought she tried to come early, then she wouldn't come. And I felt a lot of guilt for a long time, knowing that I had kind of pushed her out. And I had such a different experience with my first one that I was like, she's ready. She's going to be fine. And, we ended up in the NICU. It was terribly traumatic. She was fine. She's totally fine now. But it took me years to get over the guilt of that. And my yoga teacher once said, she's like, you just can't control any of that. She's like, my older one was born fine. The second one, she's like, I did the opposite of you. I sort of waited till he was ready and blah, blah, blah. And she's like, he was overcooked. We really have so much less control over some of this, but the emotional trauma of that, I think, is very rarely supported in our healthcare system, even among really caring providers. Because, for the most part, all the gynecologists, physical therapists, nurses, Western medicine practitioners that I've worked with in my life are really well-meaning and caring, but there's no space in that environment to have someone sit down and process your birth trauma with you, especially if it's something as mild as that, where the baby was fine, I wasn't injured, we had 10 days or less in the NICU, and they sent us home, and everyone was like, your baby's fine, you're fine, everything's fine. But as you said, it doesn't have to be a severe trauma for it to have lasting emotional impact.
Yeah.
And because pain is an expression of the brain, our emotions and our physiologic traumas really are similar, have similar long-term physical and emotional effects. You really can't separate the mind and the body. So other things that promote a more intense pain or danger signal, physical inflammation. And that can actually be from stress. As I just said, if you have emotional stress, it can trigger physiologic inflammation because of the impact of emotional stress on the brain. But also things like eating a lot of sugar and caffeine, eating foods you're sensitive to, over exercising, trying to lose the baby weight by 6 weeks postpartum, going to spin class,
Oh, there's so much wrong with that.
Well, and I was a physical therapist, and I worked in a women's hospital, and 10 weeks postpartum after my first baby, I was teaching mother baby aerobics with my kid and I thought that was such a great perk. Like, they let me bring the baby to work. It was so hard to teach that class. It's like, she did not listen, right? She was 10 weeks old.
Especially because 10 weeks postpartum, you have no core. So you're like, okay, everything's in my back.
Yeah, it was 15 years ago. So, there's much we've learned since then, thank God. But so all of these things, overdoing it, too much screen time, getting up in the middle of the night. We didn't have this as much with my older one because we didn't really have cell phones as pervasively. But, a lot of times women will be nursing and then you're kind of on your phone at 2 a.m. That messes with your circadian rhythm and causes inflammation. So there's lots of physical things that can be addressed. And all of these things can impact your pelvic pain relief. Other things, fear, lack of safety, lack of understanding what the pain response really is. And then thankfully, there are lots of factors we can pull in. And again, each woman's healing recipe is very unique that help to decrease the intensity of the pain, decrease the response to pain, a strong web of support, an anti-inflammatory food plan, which can be kind of variable from woman to woman. An autoimmune paleo diet may be very anti-inflammatory for one woman, while a more plant-based vegetarian plan may be better for another woman. This is more about you than your diagnosis. There's not a one-size-fits-all sort of endo diet or IC diet or anything like that. Again, a sense of safety in your body, having processed or gotten support from any childhood trauma or birth trauma. And tools and strategies for relaxing the pelvic floor muscles, kind of stimulating the rest and digest response in your nervous system, feeling empowered that you have a lot of tools to use to relieve your own pelvic pain, and stepping into that leadership role in your healing journey with your healing team, rather than that being on that quest to find the one person and one thing that can fix this issue. Understanding foods and lifestyle factors that make your pain better and worse, so you have choices about when you're going to do that. Some women over time, their symptoms resolve quite significantly, and they know that being on a gluten, sugar, and dairy-free food plan, is really important for their pain relief. But hey, they're going to a wedding in Hawaii. They decide to eat a piece of cake. Their pain might flare for 12 to 24 hours, but they have control over that choice. Also understanding your genetic risks and looking at any nutrient deficiencies and things that we can optimize with supplementation. So because this is so complex, there are so many systems involved, there are so many levers that we can move to optimize your brain's response and relieve the pain response in the brain, that your program, your pain relief program, will look different than anyone else with the same diagnosis. So who might be on your clinical team? And we'll help you in our Nourish Yourself, Relieve Your Pelvic Pain program, find your healing team. So we're part of your healing team, but also in many cases, women need local support from a pelvic specialist, physical therapist or occupational therapist, a functional medicine practitioner, psychotherapist, gynecologist, endocrinologist, a skilled excision surgeon, particularly if you have endometriosis, and health coaches. On your home support team, your intimate partner or spouse, family, friends, colleagues, boss, household support, carpool, just friends. Like, who can you laugh with? Who can you share some of the emotional stressors you're going through? Who can help pick up your kids from school while you go to the doctor or your meditation class? And sometimes that involves paid help. And we have you fill out webs of support as a part of the program. And so every team will be unique. You don't need all of those people, probably. You might at first. And then, you're the leader. You're the CEO of your team. You can fire people when you no longer need them, or just gracefully let them go. You can add more people to your team. Your team can change. And we'll essentially take an assessment of the team you have now when we start the program and see who might need to be kicked off the island and who might need to be added. And you can also just check in with some of the team members, maybe once a year, every 6 months. Others of your team member, you might need almost daily.
And I'll throw this out there too.
Yeah.
Just thinking about a team and everything like that. I know some people live near their families and some people don't live near their families, and that can make a difference in kind of who your team is. And it's still possible to feel connected and stuff like that and meet those people when you don't have family around you. Where I live, we live about a 5-hour plane ride from any of our family. So it's still finding those friends, finding those people that become your family and can support you. So I know a lot of people that just recently moved, or they don't live near family and it feels a lot more difficult, or sometimes you do live near family and it feels a lot more difficult. Can go either way. But just know kind of we're there to support you and find those people to help.
Yes. I didn't have any of my kids near any family. And although my mom did help out from time to time, and I have a great supportive family, but some people's family, it's worse to be around them. They can be a negative influence on your healing journey. So we're definitely here to help you navigate and support building a team. Don't be overwhelmed. If you have just one person, no one on your team right now, that's fine. We'll start at the beginning. We'll see who you need. You might need a very small team. None of this has to be overwhelming. So this is a process. Education, the research continues to evolve. So there are more and more tools and strategies available. I started working with women with pelvic pain really around 2001. And the tools that we have now are so much better than we had even then. And that wasn't really that long ago. Trial and error, trust in yourself and your body's healing wisdom, which we're here to support you build that trust, continuous networking amongst your team, stop things that are not working. And while this is not easy, it's easier with the support of others who are cheering you on and inspiring you and just having that compassionate support, which is why we are now offering this as a group program. I've worked with clients one-on-one for a long time and in small groups, and now we're offering it in to a wider audience of people who want to join this program because it's a group. And there's so much benefit from just sitting with other women around the world. We meet on a meeting just like this. You'll be able to see each other and talk and really connect with women who are in your shoes as peers, because that peer-to-peer support can be also a very key part of your healing journey, because in that peer-to-peer support, you can recognize, you can get practical support from others, ideas. You can just feel less alone knowing that other women around the world are supporting you. And you can look at more about the program by going to this link here, bit.ly/Nourish pelvic pain. And we'll list all of that detail in the comments below. So we'll be relearning how to listen to our intuition. It's turned off pretty quickly. I have a 7-year-old. My youngest is now 7. By the time she's in kindergarten, it's like, oh, you can't go to the bathroom right now. Mm-hmm. Like, what? I have to go to the bathroom, right? That'd be crazy. You just learn immediately to shut off. I'm a little thirsty. I have to go to the bathroom. So we tune out our physiologic needs. We have to relearn those, relearn some of the little whispers of what we need. Are we tired? Are we overwhelmed? Do we need to just go to the movies and laugh? Can someone just come and sit and help with the kids today? What do we need? A lot of times we know, but we don't feel empowered to listen to those little whispers until it's like, I'm sick in bed with the flu, or my entire body has broken out in a rash. Right? Yeah. And this takes practice, because probably for decades, you've been taught to ignore these quiet whispers. So let me give you an example of a woman who has gone through this program and how this works. So she was 35 years old. She had painful sex and severe menstrual cramps since her teen years. She was the mother of a 2-year-old working part-time, and she had been in pelvic physical therapy for a while, but hit a plateau. And that's a lot of the women that we see. It's like your pain gets somewhat better, but then just sort of gets stuck. She still had pain, not so much with sitting anymore, but still pain with sex most of the time. Her PMS type pain had improved, but and her pain with sex was less severe, but it was still pretty common. She had some pelvic floor muscle tightness, was still uncomfortable using the dilators. And she did feel physically overall better, less fatigued, more energy when she was on vacation, but it didn't improve her pain with sex. So it wasn't just kind of day-to-day stressors. She had severe cramping and irregular periods beginning at age 15 when she first got her period. She had laparoscopic surgery for endometriosis 8 years ago, and then was able to get pregnant after that surgery. Her endometriosis was fortunately diagnosed in her teens, but her only treatment at the time was birth control pills, which she couldn't tolerate the side effects. So she stopped after a year. Then she had chronic yeast issues since her teenage years. And she again found regular massage therapy, just like going on vacation. It helped. She had more energy, less pain, but it didn't resolve her sexual and her vulvar pain. And so she had these other concerns that she was always tired unless she was kind of getting out of a massage or on vacation. She even felt tired waking up. She felt tired at 3 p.m. There was a lot of depletion there. And she did have a history of migraines, which completely resolved when she stopped eating sugar. I referred her to a pelvic pain specialist psychotherapist for support with some marriage communication and sexual issues she was having with her partner. And we talked a lot about pain science education, which to talk about danger signals and safety signals to the brain, which we dig into a lot of that in this program because it's so helpful. The more we can turn on those safety signals, the less the brain releases a pain signal. We did a 3-day food journal. She was doing a lot of calorie reduction, trying to lose the baby weight, lots of reliance on sort of processed foods. Even though they were reduced calorie, they weren't very nutrient dense. She was eating a lot of like organic energy bars and shakes and things like that, which can be a useful supplement, but it shouldn't be the foundation of the anti-inflammatory food plan. Again, always dieting, worrying about losing that baby weight. So through this program, she developed a personalized nutrition program. We have a step-by-step process where you use our mapped out food plan for 3 weeks. And we see how that works because it's a very clean, specific food plan, but then we add things back. I want your nutrition plan to be as flexible as possible because, hey, I'm a foodie. I want you to be able to eat anything you can just because it's fun and delicious, but also because then you're going to increase the nutrients that you're taking in. If you're eating more colors of the rainbow, if you're eating more kinds of foods, you're actually bringing in a wider variety of nutrients, which is very important for healing. We also recommended some higher quality protein powders and snacks that she could grab, but not relying on those as the foundation of her food plan. Maybe once a day as a snack or, a shake for breakfast or something like that to just make life easier. That's fine. She reported slow digestion, 3 out of 10 abdominal pain after eating, and intermittent constipation. She had some lab testing, which we took a look at. She had significant signs of her gut microbiome being out of balance. So they're supposed to be healthy and unhealthy or bad bacteria in the colon. But the good should balance out and kind of outweigh the bad. It's okay. We're supposed to have tons and tons of bacteria in our colon. That's perfectly normal. But there are some bacteria that are really helpful, the probiotics, and some that can be particularly harmful. So she had too much of the harmful bacteria and not enough of the good bacteria. So we had to balance that out. And that depends on 2 things. What foods you're eating, because certain foods feed the bad bacteria. She was eating too many of those, and other foods feed the good. She wasn't eating enough of those. And sometimes fermented foods, probiotic supplements, things like that. She didn't have any yeast overgrowth, but that's sometimes an issue. We talked about digestive function recommendations, just mindfully eating and chewing. I had a patient just last week. The only thing we changed was how she ate, not what she ate. And what happened was she went home for the first time in her entire marriage. They had family dinner. She had no pain that night. Sometimes little things make a huge difference. Sit,
and especially
relax,
with that, like everything normally you're just shoveling food down your mouth because you're trying to take care of this one, or people are so busy, they're running from activity to activity. So I think, definitely that mindful eating thing is huge.
It's huge. For her, she also needed some digestive support, digestive enzymes, L-glutamine. We'll talk about all of this stuff in the program, demulcent herbs, zinc, bone broth, high amounts of mineral broth, and antimicrobial herbs and probiotics to help balance out that gut bacteria. We recommended that she go back to pelvic floor physical therapy while we were doing this collaboration, so that while her gut was healing, her immune system was healing, her nervous system was healing, that she could also maybe break through that plateau in her pelvic floor muscle tension. We were also doing, reduced inflammation and things like that, working on down training, relaxing the pelvic floor, sitting appropriately for toileting. It's funny. You think you know how to sit correctly on a toilet. The vast majority of people don't. That's why the squatty potty is so popular, if you've seen that.
Uh-huh.
Yeah. And we can talk all about that in the course. With PT, she also added home manual therapy and had some support and assistance from her partner, learning from her physical therapist and from her psychotherapist how to support different sexual positions can be helpful, different communication skills. When I was doing a lot of hands-on physical therapy, I brought spouses in a lot to talk about what's a safe communication situation so that this woman can completely relax her pelvic floor. Nervous system down training and adaptive neuroplasticity support, which just means getting the brain to trigger safety signals rather than tons of danger signals. We supported the mitochondria of the brain, which helps to rewire the brain for less pain, with lots of nutrients and also supplements, more vegetables, restorative yoga, and then slowly she was able to tolerate more intense yoga, a certain kinds of breathing exercises. We've actually included the 4-7-8 breathing exercise in the Getting Started guide, which is free. Mm-hmm. I'll give you the link at the end of this presentation. And she had started to build and develop a daily mindfulness practice. And we looked at her endocrine health. We looked at some hormone labs. We looked at how her stress hormones were out of balance, how her sex hormones were out of balance. She had not enough progesterone to estrogen. Her thyroid was normal, but she had some key issues with her sex and stress hormones. And so again, in collaboration with cognitive behavioral psychotherapy, we did health coaching. We worked on her lifestyle. We helped get her circadian rhythm back in balance, which is really important if you've recently had a baby, because if you've been nursing all night or your sleep schedule's gotten off, a lot of times that has to be rewired. Or if you work shift work, or you just, you have a history of being a night owl and, you've got to get that retrained. And there's also certain supplements that can help support stress and sex hormone balance. So she no longer needed a surgeon on her multidisciplinary team, but we added back in temporarily her pelvic floor PT, added a psychotherapist, worked to find an integrative gynecologist to do her regular, yearly checkups and physical exams, health coaching to build intuitive skills for decision-making to help her then feel more confident about building her team and firing people on her team that she didn't need anymore, and also building her home team. Over the course of 6 months, this patient's pain was fully resolved, except for occasional flares when her work or marriage stress level increased. So again, just having awareness of what's contributing sometimes to these pain flares and how can I mitigate them. And as I said, she knew that the gluten, sugar, and dairy-free food plan was better, but she went to a birthday party, ate a piece of cake one time, her pain flared, and she's like, all right, I knew that was going to happen. Let me get back to my good food plan. And, her flare was short lasting, 12 to 24 hours. And she was able to return to pain-free sex within 2 weeks of completely getting back to her pain relief recipe. Because now she understood, she knew all the different tools and strategies she had for her own unique healing recipe. So we've created this program. It's educational, supportive, and active to help you overcome these 4 common challenges to pelvic pain relief. And the program is called Nourish Yourself, Relieve Your Pelvic Pain Program. And there is the link, bit.ly/Nourish pelvic pain. And we'll post all that below. And we have the free Getting Started guide, which I will also post below, just has some recipes and some exercises that you can start on your own. And the program itself is 12 online modules. So you can do this program. If you can see this video, meaning you have an internet connection, you can do this program. This is for anyone in the world. We've worked with patients and clients and students in more than 40 countries around the world. So if you have an internet connection, you can join us. Our program focuses on mindset, optimal health and your optimal health vision and values, your particular goals, a step-by-step plan to help you learn how to personalize your food plan, 2 modules on specific supplement support, and we'll explain the supplements, lifestyle strategies for quieting the nervous system. Remember, pain is ultimately a decision that's made by the brain. Lifestyle strategies for pelvic pain relief, building your healthcare team and home web of support, pelvic healing movement, and 2 modules on healthy hormone balance. This program has been tested by hundreds of clients at the Integrative Women's Health Institute with great results, and based on my nearly 2 decades of clinical practice, and Hilary is bringing her unique clinical perspective, but also her personal perspective. And I think both of us having our own stories really helps us to, guide you in a way that's very compassionate. We understand that this is not always an easy road.
Yeah. And I would say too, that probably some different women watching are just some feeling a little bit overwhelmed by it all. And it's just, we can help you take those step-by-steps, those baby steps to get through it. Because I know a lot of times when I'm working with women in the homes and with parents and families, and just the idea of implementing one more thing, they're just like, oh my gosh, like I can't do it. And we can help you make it achievable, make it possible. And you might not be able to do everything this time around, but just taking little steps will help on that healing journey.
Yes. And we'll be there over time. Each session is 12 weeks. If you reach one goal in 12 weeks, maybe you implement a mindfulness practice. Maybe you just turn down the volume on some of those pain danger signals in your brain in 12 weeks. That is significant. And, I often use this quote, and I don't know who to attribute it to, but we often overestimate what we can accomplish in a month, and we vastly underestimate what we can accomplish in a year or 5 years, 10 years. So if you're sitting at home and, you're working full time and you have 3 little kids and you're exhausted and you're like, oh, I have pelvic pain, but I just can't do one more thing. Sit with us, join the calls once a week, be surrounded by supportive peers. We're here to support you. Make one shift in your life in this 12 weeks, and you'll see these health improvements start to snowball. Success does really build success. Anyway, the program also includes cookbooks, specific supplement recommendations and we'll show you how to choose high quality supplements. Quality really does matter. And so thank you for joining Hilary and I here today.
Thank you.
Thank you. And we really invite you to join us in the Nourish Yourself, Relieve Your Pelvic Pain program. You can join us today. The program starts next week, so you've got a few days to make your decision. And I will post all the links for the free Getting Started guide and to learn more about the program in the comments below. And if you have any questions, please feel free to post them in the comments below. So I'm going to stop sharing this. And let's see where we are. Here we go. Let me see if I can see any questions. I don't see any questions right now. So I'm going to wrap this up, and we will be chatting with you in the comments to answer your questions at any point throughout today, tomorrow. We'll just keep an eye on it. So I know that not everyone has time right in the middle of the day to stop and listen to all of this information for an hour, but we are here to support you and answer your questions at any time that's convenient. So thanks so much for being with me today, Hilary.
Thank you.
All right. We'll see you guys soon. Bye-bye.
Bye.